something that the council is uncomfortable with, then it can be removed.
Okay, now what about
I will also note.
Yeah. Go ahead.
I will also note an urgency ordinance needs a 4/5 vote to be adopted.
Okay. What about if you look at all of these, okay? The worst one is the very last one on page 1. That's the one that actually talks about putting adults in jail. What if we just struck that one?
The one that says, whereas an April 2017 report, that one?
Yeah. I mean, the other one is...
I think that would be fine.
The next one is like, it's stating that that's from UCLA, so it's a report. What you're talking about is a report, too. It's a April 2017 report by the American Academy of Pediatrics. It's what they found. All of these whereases are from actual reports that somebody else found. It's not what we're saying. Right, but we're still approving it. Putting it in our ordinance. Substantiates why this is an urgency order. But it's all, yeah.
If I could real quick, I just want to point out that this is for privately run
It's not
detention centers, not
right.
government-run jails and prisons. We all know that bad people need to be put away.
But that report, the pediatric one, it refers to all detention centers. So it doesn't refer to, it doesn't specify. That's why I'm saying maybe that one could go and then we could.
Tom, if I understood what you said, that particular whereas that starts at line 23 on page 1, that one could be removed without adversely affecting the urgency requirement.
Well, it may reduce the effectiveness, but we still would have other facts and other statements and other reports that would still support urgency.
Well, I have to agree with the comment that Councilmember Percival made that we're talking about a very specific type of a detention facility that would be privately operated, and those were the things that the state attempted to outlaw because of concerns about privately operated, and I certainly concur that our objective is to make use of penal codes and other codes that are at our disposal for our law enforcement officers to enforce and locate and apprehend and successfully prosecute criminals. But if we need to have certain verbiage to constitute an urgency ordinance, and based on my understanding of what has brought this before us tonight, I think there is an urgency to get something passed to head that off.
And I'd rather be safe than sorry.
And I don't disagree with the concerns that Councilmember Meyer has on some of the terminology and the references made in this, but those could all be appropriately addressed through the Planning Commission process and ultimately getting another ordinance to us to review and approve. So, if there's no more comments, I will ask if somebody wants to make a motion on item 10A.
I move to approve.
I have a motion to approve.
I'll second.
And I have a second. Roll call vote, please.
Councilmember Meyer?
I'm going to state for the record that I believe that we need this ordinance, but I can't stand behind all the whereases in here, so no.
Councilmember Percival?
Yes.
Councilmember Wright?
Yes.
Mayor Pro Tem Krupa,
Yes.
Mayor Brown.
Yes. Motion passes. All right. Thank you, Tom. Thank you, HP. We will, let's see, where are we here? Okay, so Deputy City Clerk, if you would please read the ordinance by title only.
An interim ordinance of the City of Hemet, California, prohibiting the construction or operation of private detention centers and community detention facilities for unaccompanied minors in the City of Hemet.
Thank you. And moving on to item 10B, our second discussion item. Is it novell or novel? I've heard it both ways. Coronavirus COVID-19 emergency proclamation update, and City Manager Lopez also acting as emergency operations director. Will you give us a staff report on this?
Thank you, Mayor. You'll recall at the March 16th special meeting that was agendized, taken care of last week. The council made a specific request to have this item on recurring subsequent meetings with updates related to the status of what's happening in the city. And so on March 16th, the council declared a local emergency which involved the following: acknowledgement of the risk that the potential further spread of COVID-19 presents to the public health and safety of persons and property within the City of Hemet. Declared a local emergency as authorized in Government Code Sections 8630 and 549, 56.5, and Chapter 26 of the Municipal Code. Also authorized the use of teleconferencing and other electronic means to promote and maintain social distancing among council members and the public while handling the city's business. And four, finally, authorization of the city manager as Director of Emergency Services to exercise his powers and duties as provided in the Hemet Municipal Code and pursuant to the Disaster Preparedness Plan. So I think item number 3 in particular is obviously what we're experiencing right now, the use of electronic means, teleconferencing to reach out to the community. As you know, the county health officer has directed that any gathering with more than 10 people was unlawful. As a result of the emergency declaration that was proclaimed on March 16th, there was a series of actions that I took with respect to City Hall facilities. And I'll just go over some of those that are also included in the staff report. Starting that day, we closed the city service counters at City Hall, Covell, and the Public Works Yard to only allow public access between the hours of 7:30 and 10, and then 3 o'clock to 5:30 in the afternoon. We also authorized the police department's lobby to be closed to the public, and also canceled or postponed a series of city events, as well as reservations for city facilities, and canceling other city-hosted events, including the Hemet Police Citizens Academy, Hemet Fire and Police Ride-Along programs and public tours, and also paused the Hemet CERT team for the time being. In addition to that, there were other major events in the community that were canceled, including the Ramona Pageant and Spring Festival, and our partners over at Valleywide also closed the Simpson Center to the public. Shortly thereafter, I provided a memo to all staff outlining the precautions, the measures that were to be implemented across the city, including guidance from the CDC as well as Riverside County Public Health to ensure that our employees were practicing good practices to make sure that they remained healthy and safe and didn't expose themselves to potential exposure moving forward. Shortly thereafter, we limited City Hall occupancy in terms of the public lobby to 3 members of the public at a time. So with the counter staff that we had at City Hall, community development, cashiering, we were only able to allow 3 others to maintain the 10 people within a room. We provided seating outside of City Hall so that as people waited, they were able to sit down. In addition to that, all meetings that had 10 or more people were canceled, including meetings such as the Measure U Committee and other community meetings as well. In that time, Clay, I got to give a lot of kudos to Clay and IT, Scott, Ty, and the rest of the team. They were able to develop measures to allow for public comment on the website. So the members of the public are able to go to the city's website. They're able to provide public comment that will then be read aloud to the community on the record. So far in today's meeting, we didn't have anybody that utilized that, but it will be there. I think some of these things that we've implemented will remain in the future, even as this emergency is put to bed. I think we'll still continue to operate some of these things in the future. On March 18th, all service counters at City Hall, Covell, Public Works Yard were closed to the public. Staff continues to provide services, but that staff is only available by way of telephone or email. And so we've followed up with numerous residents through this manner, and we still are engaging the public and still interacting with them. We're working with the Chamber of Commerce to develop information and collaboration that we provide out to the public as well, so that the public continues to be updated on the information as we receive it. We've implemented and instituted a number of new items to keep the community informed. We've developed a web page where we update that multiple times each day, hemetca.gov/COVID-19. The public was provided with a how-to guide on conducting electronic business with the staff. We provided email, we provided phone numbers so that the public can still interact with our staff. We've developed measures that will help institute online or electronic permitting and community development. So we're working through those opportunities. We also suspended water service disconnections. During this time, it may cause delays for some of our residents, and we didn't want to penalize any of our residents for being unable to make it physically to City Hall to make their payment. So we've suspended those water service disconnections. Library book dates, due dates were extended until May 6th. And again, online resources that we're continuing to develop on the daily were publicized on the city's social media platforms and websites. And last Friday, staff had the opportunity. I want to give much thanks to Scott Underwood again for coordinating, and Erica Murphy as well for coordinating the recording of a mayor's informational piece that went out. And the last that I checked, I think it was this morning, that has reached over 20,000 residents by way of Facebook. I should also mention that some of the posts that the staff had made, in particular Erica, with some of the infographics that she's also created, have also seen a total Facebook reach of over 20,000 residents as well. So we're seeing significant outreach to the community. We're seeing the public share our information as well, which is really great because then it's getting to more people. Different individuals get their information differently, so we do have different social media platforms. We have Nextdoor, we have Instagram, we have Twitter, we have the city's Facebook page, and we have the city's website. So we've made sure to be consistent throughout all of those platforms because, as I mentioned, individuals get their information differently. So we'll continue to monitor the feedback that we get. We're continuing to update the website. We're continuing to update our social media as information comes in. There's a number of other projects that we're currently working on to help encourage the governor's orders, as well as some of the guidance that's been provided by the county health officer. And so it's evolving, it changes on the daily, and we're continuing to make sure that we're responding, interacting with the public as well, because they should know that business is continuing, it's just continuing in a different manner. I should also note that we're looking at different mechanisms to make sure that the staff can work off-site And so we're instituting different measures to make sure that they can still accomplish their work, but not physically be present here at City Hall or any of the other city facilities. So it's dynamic. There's a lot of changes that are happening. I know that public safety is here to provide updates that the public, I'm sure, would like to hear about as well. They've done an incredible job with providing information to the community as well. They've done an incredible job with partnering up with neighboring law enforcement. I know Chief Brown is plugged in multiple times a day with the county to talk about any updates that come through, and I cannot thank them enough and commend them enough for the work that they're doing day in and day out. We have 2 daily briefings where we provide updates to one another so that information is continually flowing amongst the 3 of us, and it's absolutely critical that we continue to have those updates moving forward. In addition to that, I want to give a huge thanks to our city staff. They've really adjusted phenomenally to the changes that we've had to implement, and I have seen nothing but positive attitudes, nothing but a great view on how we're going to get through this, and so I cannot thank them enough for how much that they've done. In particular, I know that Tim Burke with SEIU has been first to the table in determining and understanding that we were going to go through some challenges. Labor is a key component of this, and I just cannot thank the employees, our labor groups enough for coming to the table and understanding our challenges and really coming up with solutions collectively, because as I mentioned, labor is a key component in how we're going to move forward. So I cannot thank them enough, and thank Clay, Scott, the E-team, everybody else for doing their part, and really making sure that our customers, our residents are making sure that they've got the they've got the questions that are being answered, and we're still providing that customer service to our community. So that's the update that I have. I know both chiefs are here, and they can provide additional information to the council as well as to the community as needed.
Thank you, Chris. I just want to make a note for the record that public comment opportunity was provided earlier in the meeting under item 5, and we had no communications from the public. So do we have any members of the council that would like to ask questions or have comments?
I do have something to say. I know that they had a WebEx today with regards to applying for, because once you maintain an emergency disaster episode, there was a WebEx today with regards to the GREAT Act and the reimbursements that are available for emergency response, public safety, economic hardship, all of that being conveyed today during that WebEx, and using the GREAT Act as a streamlined process of reporting and such, so that it's not as cumbersome for those people applying. So it's in our best interest to identify, as we have, an emergency disaster within the city based on the coronavirus, and being able to get back some costs reimbursed by the federal government.
So I'll add a comment on that. I know Chief Brown was at the very onset of declaring that emergency. Chief Brown worked with finance, and in particular Lorena, in identifying codes that we could utilize to make sure that whenever there's a expenditure of time that we're able to track that. So I want to thank Chief Brown for being on top of that immediately and identifying that, so that in times of reimbursements, when we need to go through all of that, we've already been taking care of that as of last week.
I do have something I'd like to piggyback on that. I think it's great that the city has the ability as a government agency to be able to get a lot of these costs reimbursed because the city has declared an emergency. I would like to see if there's some mechanism that the city can provide to our local businesses that have been greatly impacted by this, by loss of revenue from loss of business because of these stay-home orders. If there's anything that the city can do to help local business to be able to recoup some funding that may become available from the federal government.
It seems like we're getting updates on the hour, whether it's from our friends at the federal level or our friends at the state level, that they're constantly providing information. Even at the county level too, the Economic Development Department is providing information, and we do our best to provide that information on our website. And so hemet.gov/COVID-19, we're trying to do our best to include all that information, the resources for residents, but also information for business owners as well. So we're also providing that to the Chamber of Commerce as well, so that collectively we're sharing the same information, and the more information, the better.
Thank you for that. I just want to state for the record that I don't make this claim because I want to support any type of socialist policies. What I do want to state for the record is that government created this problem that caused businesses harm, financial harm, and that it's government's responsibility now to fix the problem that they created. So thank you.
Other comments or questions?
So I just wanted to give an opportunity for both chiefs. They've done an incredible job. If they've got any information that they'd like to share, I'm sure the council may appreciate that, as well as members of the community that are watching. So I want to give them the opportunity to provide updates as well.
Let me ask my question first,
Sure.
because then you guys, it's for both of you. Just if you, I know that Chief Brown, you've discussed different ways that you are protecting staff in your department. Maybe you guys could just talk about, either like if you're closing your offices, or if there's station closures, or you know what I mean, things like that. Thank you.
Thank you, Mr. City Manager, and thank you for your leadership. We do appreciate that. Mayor, members of the council, I'm going to give you a brief overview on our current operational stature right now. We're treating this event as an incident very early on with the support of our city city manager. The fire and police team got together. We've established an incident, and I'm going to share with you some of the objectives that are driving the day-to-day decisions, both at the leadership level and policy level. Those broad-based objectives are to limit the spread of COVID-19, implement county public health policy orders, ensure continuity of operations, identify and prioritize essential functions, deployment as demand changes. We need to be very flexible with that, ensure coordination with local, county, and state partners, ensure internal and external communications to reduce rumors and to prevent unnecessary panic, protect our critical infrastructure, identify and protect our at-risk population, and finally to maintain social order. Those are the broad-based incident objectives that we apply. We meet daily, twice a day. We validate those every day. They change and are subject to change. Our Emergency Operations Center is in management watch. The Riverside County transitioned to their main Emergency Operations Center effective the end of last week, and we're now coordinating on a countywide level with them. I want to give public acknowledgement to Kat Henderson, our Emergency Services Coordinator, that has worked tirelessly literally the last 7 days straight to ensure that that operation was seamless. Most importantly, and I think I speak for the police chief and our team, that our focus is to implement procedures and to provide our first responders, both police officers and firefighters, the tools that they need to get the job done. Now, towards that end, we've implemented a COVID-19 modified operational response plan and have implemented safety measures for both the fire department and the police department. So what that means daily, effective Monday morning at 0800, we've modified how and what we will respond to. We took a very dramatic look at non-emergent calls, and with the support of the county approval of REMSA, we've implemented our dispatch pre-screening protocol that allows us now to basically focus on the emergencies. And so typically, and these are interim provisional measures, we will not be responding to what are normally public assist calls, non-emergent calls. We are very aggressive with the outreach with our public to make sure they understand that, and we continue to work very carefully to ensure that they understand why we've changed that operational tempo. Ensure operational capacity is adequate to handle potential surge needs. We've built contingency planning for 10% through 50% reduction of workforce due to illness, ensuring that we'll be able to maintain uninterrupted emergency services. What that means is we'll redeploy units, we'll redeploy small utilities, engines where needed. We have that flexibility to maintain that as it relates to the impact of the current events in play. We participate in daily operational conference calls with REMSA, the Emergency Management Department, Public Health, and I am currently the duty officer for the Operational Area Coordinator along with the County Fire Chief, and will be in that position for the next 2 weeks. We coordinate, discuss every impact that affects the county, what's happening at the state level, so we're directly plugged in, and that has been very helpful for us to make the decisions that we need to make. We've developed a quarantine contingency planning for exposure for any of our employees. We've developed that in cooperation with our Hemet Valley Medical Center, and I want to thank Dr. Chaudhry for that support and their continued support of our city. We've ensured operational safety of our personnel. That's job one. And I do want to mention PPE. We've heard a lot of discussion about the N95 mask, surgical mask, and gloves. We've implemented the countywide mandatory exposure protocol that dictates how we're going to employ those PPE devices. We have adequate supplies of the N95 mask. We've had additional supplies provided through the county. We did receive another 240 from the hospital yesterday, and those are part of our additional capacity if we need that. I'm also pleased to report that Assemblyman Chad May's office contacted our department today to offer us the help to get additional N95 mask capacity and gowns. And his chief of staff contacted me directly, and they're in the process of making that happen, so I'm very pleased with that. All those things that I just described are being distributed to our frontline police officers and firefighters. Both your police chief and fire chief are working together. That's our job, to make sure that our people are taken care of. Our inventories are adequate. We've been working hard to keep that and get ahead of it. And right now we're in pretty good shape as far as our inventory. As I indicated, REMSA medical protocols for infectious disease exposure are in place for both fire and police. We've developed in 2016 a City of Hemet exposure protocol that outlines the process for our personnel, both fire and police. That's been distributed. And we also have an exposure protocol, and those have been distributed to each one of our firefighters and police officers. Social media and media relations, as our city manager indicated, we monitor trends. We coordinate citywide messaging with Erica Murphy and the city manager's team, and we have direct contact with the EMD Public Information Office, so we coordinate all messaging that comes out of the city. I want to give a brief example of what happens with misinformation and rumor mill, and that is a real important part of this part. We had a report earlier today that confirmed a local COVID-19 contact, and that was spread like wildfire on social media. That creates a lot of impact because we directly involve public health. They institute their internal review. A lot of impact in terms of following up. According to our public health partners, there is no current COVID-19 patients in our city. Now, they report out by regions, not by the city, and they've done that by design. And we get those reports every early in the morning, once mid-afternoon, and late afternoon. And as that changes, we report that direct to you, the council, and to the community. And lastly, our local care, senior care facilities. We have 16 facilities. We have formed a citywide task force to establish direct lines of communication with each of our senior care facilities. They participate in a standing operational briefing every Monday at 11:30. We've included Dr. Samantha Chaudhry, the Chief Medical Officer from Hemet Medical Center, and she provides medical advice and support to the representatives of those facilities. And we provide real-time updates and, more importantly, exchange of information, because they may have patients or residents that are under quarantine or self-quarantine. That's important information for us to know and be out in front of it. I just will close that we appreciate your support, and we have many other people that are helping. I'd like to thank our team, and in particular our admin, our firefighters each and every day that are out there making things happen. Our AMR team, who's been fabulous, we now have done a modified response plan. So many times AMR will be responding to these emergencies or non-emergencies on their own. They've been very cooperative. Again, Hemet Valley Medical Center, County Public Health, we have an excellent relationship. We have relationships, pick up the phone, we have an issue, city manager wants to chase something down, and we have that ability to do that. So I really appreciate that. And with that, I'll hold for any questions and pass out to our police chief.
Thank you, Chief.
Good evening, Mayor, council members. We've adjusted from the beginning. We've done a good job to assure that our employees are safe. Some things that we had to do that are vital functions, of course, as you know, we had to suspend our volunteer program, as well as our Explorer program and other programs that was mentioned by the city manager. Internally, we're making sure that our dispatch center is isolated. There's no contact with inside. We make sure that our officers are, we talk to them, make sure that they're healthy when they come to work. Our services have been adjusted. Our dispatchers on the onset, we're asking public health questions to make sure that our first responders were not going to be exposed to the coronavirus, which is very important. Made sure that we have enough PPE available for our officers and our firefighters. We went further with phone reporting and pushed out our online reporting, which assisted a lot. We are still responding to calls, emergency calls. In fact, the city manager was involved on-siting a call yesterday. So we're out there enforcing the laws just to let everybody know day and night. It's very important. Other safety measures, I'm in direct contact with all the other chiefs and sheriffs within Riverside County, as well up and down the state and Cal chiefs, discussing the way we handle things, any issues that arise. So that's very important, make sure that we're on the same page in Riverside County. Other than that, I'd like to say thank you to the city manager. He's done a great job. Communication is a key part of this, and keeping that communication within our staff, within the city, within our employees is very important, and he's done a great job with that. If you have any questions for me, pretty much with safety with our employees, that's what we have done.
Thank you, Chief. Bring it back to council. Any other comments or questions?
I got one question for the chief, police chief. I just want to confirm that we're not using the stay-home order as probable cause to make stops and searches and that kind of thing. That we're still enforcing the law under the penal code and the codes that are available to our officers.
Yes, this is a public safety sensitive issue, foreign to law enforcement, as you know. We're asking for compliance. It's the social distancing, that's very important. People need to go get their essential items that they need, medical supplies. Go get those, drive out, make sure you obtain what you need, go back home. This is something we got to watch out for our families. People are more susceptible to getting this, and it's difficult. I mean, people are in isolation. I understand that, but just like we're changing things, there's things they can do. Video chat with your family members that you don't have contact with. It's very important. It's just a difficult time right now. We got to make these changes to make sure that our community is safe and our first responders are safe.
Thanks, Chief. I appreciate that. And I do want to point out, I didn't want to sound harsh earlier that it's government's fault. I want to commend our local departments and our local government officials for being at the forefront of providing top-notch leadership to our community and being there for the citizens that live and work in our city. So I want to thank you all for that and everybody that works for your department. I do realize that this is a health crisis issue and people need to be responsible and take precautions to stay healthy. So I just want to point that out.
Bonnie? Comments? Okay. Linda?
Just that you guys are doing a great job, and I really appreciate it. All staff, I think, has really stepped up to the plate and continuing to do that, and I really, really appreciate it. I've been getting comments from people all the time. How do we do this? How do we do this? Oh, That's right, it's on the city website, and that's appreciated in the fact that there's been a couple videos that have been posted with information. People are, it's good. It's, and the fact that you're all responsive.
And actually, there's
and
probably
that's
been
good.
more communication through this crisis than ever before.
Yes.
And the public is noticing it. So, and greatly appreciative, as we are, as council members, because we get the backlash too, if in fact they don't feel like they're getting the communication that is needed. So appreciate all that, really, on the social media sites as well.
And just like to point out, Eddie, what you said, that, asking people to comply with the state, and they're not orders, in a lot of cases, they're requests. I mean, it's like, come on, this is for the well-being of everybody in the state of California to do these things, and that if you're out driving around and you see, 15 people going into a grocery store, we're not going to arrest people for walking into a grocery store. And, use a little common sense. If you see that, stay away from them. It's that type of thing. I mean, we really have to police ourselves, excuse the expression of policing, but, we're the only ones that control what we do. And, the rules and regs are coming out, they're changing, the websites are there, the information is there, but we're not on lockdown, we are on requested isolation, and there's a big difference between the two words. Thank you.
Arlene, anything further?
Maybe when it's all done, everybody will use more hand sanitizer and keep us a little cleaner.
I'll share.
Can I ask one question of the city manager? With City Hall closed, how do the people that pay their water bills with cash, how are they being accommodated?
So there's a number of different methods that we still utilize. They can pay by check, they can pay by phone. I think Lorena may be still there.
Yeah.
She's there.
She can talk about some of those things that we've done, because, we do have a lot of residents that still do things the old-fashioned way.
Yeah, one of my neighbors called me and said, how do I pay my bill? And I went, don't give me the money.
Yeah, so we have a number
He doesn't have a checking account.
We have a number of different methods that we've instituted, and Lorena can talk about those if she's able to.
So we have an online portal where people can pay. They can also sign up through that online portal for automatic payments, where the payment would come out on the due date of the bill. They can pay by phone 24 hours a day, 7 days a week through an automated system. They can mail in their payment. They can sign up with us for ACH direct draft from their checking or savings account, or they can drop off a payment in the payment drop box that's in the parking lot here at City Hall. We don't have an option for cash right now. It is not recommended that people put cash in the box, but banks are still open. They can get a cashier's check if they needed to. And one of the items that we were actually going to bring forward was a new invoice printing and mailing system that includes a program called Pay Near Me that has a barcode where customers can take that invoice to any 7-Eleven store, which I believe is one of the many places that take Pay Near Me, and they can pay there with cash when they're getting gas or getting their coffee in the morning or whatever it is. But because that wasn't an urgent item, we were asked to hold back on it.
Thank you. You do take money orders through the post office?
Yes, we do.
Okay, thank you. Appreciate everything that you guys are doing.
And if you have residents,
Of course.
tell them to give us a call. We want to work with residents. We want to work with our community. So if you run into someone like that, tell them to give us a call. We'll work with them. We're people too, and we understand the challenges that are created right now too. So we all understand how it's going to be for at least the short term. And so we want to work with our community, we want to work with our residents. So give us a call, we'll provide more information. And then just finally, I'd like to add a couple moments or a couple comments that, at the end of the day, by state law, all of us at the local level are emergency service workers. And so the fact that the staff is still coming to work, understanding that this is the time that, this is our time to show why some of us got into this line of work. And so we're here for the people, we're here to provide that resource, and we're here to help. And so we will continue to be here, we'll continue to offer help however we can. So the public's hearing, give us a call if you need anything, we're happy to help. And even if we don't know the answer, we'll point you in the right direction if we can. And then I know Chief Poos mentioned that PD is still taking care of business, and they are. I was getting gas last night and saw one of our officers chase down someone. So our folks, our men and women in the police department are outstanding. They will hunt you down, so don't run from them, because I saw what happens when you try to. So I want to give many thanks. I know we've got a couple officers here, Corporal Gomez. Yeah. I talked to him last night too. So incredible job that our men and women are doing in the police department as well as in the fire department too. So,
like I said, you mess with the best, you lose like the rest. I'd just like to underscore all the comments that have been made, and it makes me incredibly proud of being a member of this team. The work that our staff has done under constantly evolving and changing circumstances, the creativity that our administrative staff has come up with, ways of adjusting, doing our business, and still keeping the ship moving forward. The way that our police and fire departments have coalesced and made adjustments in their daily operations, and they're doing so almost hour by hour as circumstances change and demands change. And the work that's been done on our city's website to provide information to the community. And I want to just reiterate that that's the best source for local information. If you want to get accurate information, being first out with information doesn't do you any good if it's not accurate. And so, yeah, the city machine may move a little more slowly, but you can pretty much bet that what comes out on the city's website is going to be valid information. I want to mention also, too, as the city manager said, that we have information coming in from the county level, from private sector, from the chamber, from the state and the federal level, and it's almost information overload. And so one of the things that's a challenge, and I realize that Erica's probably the one that's filtering all of these things, but there's a lot of good opportunity to add some additional links to our website, that somebody may go to the website and they may have a specific question, like Mike mentioned earlier about small businesses and how they can get some assistance. So keep watching the website for those updates and the new links to information. And it is always in flux, but I just want to say thank you so much to all of our city staff for what they're doing to rise to the occasion. Makes me proud. Okay. Well, thank you for that update, and it'll be a recurring item as long as we have to have it. So now we're on to City Council and staff reports. If at all possible, please limit your comments to include only essential items, and I know that a lot of us are having things canceled off of our agendas, off of our calendars left and right, so there may not be a whole lot to report, but we'll start with you, Carly.
All my items have been canceled.
That was quick.
All my items were canceled also, so I have nothing to report.
Okay.
Nothing to report on what items canceled as well?
Guess what? Not all mine were canceled. However, they've all been canceled up until Thursday. RTA is going to try the teleconferencing board meeting, which will be the first one that I will be participating in. RTA. So more of them are coming forward. SCAG says they're doing 2 of theirs. RCTC is going to do it. So we'll see how good we all are at those things. And the other thing I just wanted to say is, you know, to the residents, the library store may be closed, but they've got the most fantastic website and links on the library website. And you can request books that are in the library catalog, and they will put them in that little gizmo machine outside, and you can go down and pick them up. So, you know, utilize reading. It's good. They have homework and tutoring and all of that other good stuff for all the kids that are out of school. So learning and reading doesn't have to stop just because the doors aren't open. That's my plug for the library.
Okay, the only thing that I have is under the WCE, the mailers are going out. Starting to get some questions. A lot of them are showing up on Nextdoor and other social media. The WRCOG staff that's headed up by Tyler Master, who, by the way, was scheduled to be here to give us a presentation and an update on that at tonight's meeting, but that's been pushed down the road. But they're still moving forward. We're still looking to roll out in Hemet in May, and his staff is monitoring the social media, and they're creating responses back to people that are posting things like that. And I was in communication with him and asked them that maybe it would be beneficial to create a frequently asked question page that they can post up shortly. So I got feedback from him. They're looking at all those alternatives. Ad hoc committee reports, Florida Avenue.
Still there.
Okay. And CDBG is finished. And the Council Protocols Ad hoc Committee has yet to convene. I think we're going to have to push that off until we get through this emergency situation. So, City Manager.
I've provided my update. That's embargoed.
You're up to date. We're up to date.
Thank you.
Item 14, future agenda items. No. Status quo. Yeah. Okay. That brings us to adjournment. So thank you all for participating. We appreciate everybody's indulgence for these unique adjustments that we did. I think we did okay. We're adjourned.
Thanks, Tom.
Until April 14th.